Hi, I'm Steve Adubato. A compelling, important conversation about our healthcare, the healthcare of those who are most vulnerable in our community, in our society. We have Maisha Simmons, who's director of New Jersey Grantmaking at the Robert Wood Johnson Foundation. Thank you so much for joining us.
Thank you so much for having Steve, and I'm so happy to share with you and your audience about what the Robert Wood Johnson Foundation is doing to achieve a future where all New Jersey residents can be the healthiest that they can be.
Why is that so challenging for so many, particularly people of color, Maisha?
You know, Steve, historically, we've seen that Black and Brown people in this country haven't received adequate health care and adequate access to other systems. So at the Robert Wood Johnson Foundation, we have a commitment to building a culture of health where everyone in America can live their healthiest life possible. But in particular, our work in New Jersey is focused on a statewide approach to policy and systems change to ensure that practices and policies are put in place so that we can experience full, healthy lives.
Well, first of all, I want to make it clear that the Robert Wood Johnson Foundation supports a whole range of New Jersey-based organizations. They support our health care program, our public awareness program. And one of the areas I want to talk about specifically is the impact of COVID in terms of exacerbating the problems and the challenges you just described.
You know, COVID is a pandemic that we're still dealing with, and with its global implications and national implications, there's a lot of systems that were stressed. But in particular, our public health system, the system that's designed to mitigate disease and inform the public about healthy choices that they can make, it was particularly stressed. And the reason is that all across the country and even in New Jersey, we've seen disinvestment from our public health systems. So now we are actually thinking about what does it mean to have a robust and stable public health system that supports the needs of people in the context in their communities. I'll give you an example, and it's widely known, but it really stresses this fact. Back when testing was available, testing sites popped up all across the state, but you had to have a car to get to those testing sites. Later, we recognized that misstep, and we centered testing sites in community. Well, what would have happened if we would have started with what the community needs were first and really put those sites in the context of the place where people who were experiencing the highest amounts of COVID getting services that they needed early? That's the types of shifts that we're thinking about we could have in a much more robust and stable public health infrastructure.
Maisha, I want to follow up on this point. Vaccine hesitancy, resistance in the African-American and Latino community, but more in the African-American community. A, the reasons behind it. B, what do we need to do to get it to where it needs to be?
You know, Steve, historically, there's been mistrust in African Americans about our health systems and public health systems. And that comes from years of structural racism and practices that did not favor our communities. And so this pandemic struck, there's a lot of misinformation, and our communities do not have the time to really think and you know, they really want to understand what is relevant for them. So vaccine hesitancy is really real, but there are ways that we can work in partnerships with our communities to mitigate that fact. And I'll give you an example. Right now, we have a grantee, a wonderful grantee, that's partnering with the Department of Health in New Jersey and community-based organizations. Those community-based organizations are trusted. They're members of the communities. They're going out into the communities, sharing relevant information, taking the time to have folks understand what these vaccines are about, how they can impact them and their families. And also with those conversations, they're also partnering with the Department of Health to actually administer the vaccines. So it's just time, right? It doesn't mean that folks won't get vaccinated eventually, but we need to work in our communities diligently to make sure they have the right information to make the right choices for them and their family.
You know, you told our producers, as a Black mother, I'm disheartened to know that another mom like me in New Jersey is 7 times more likely than a white mother to die from maternally related complications. Not to mention the situation for African-American babies, 3 more times likely than white babies to die before their first birthday. Those numbers have remained constant. Why are we not making more progress?
You know, Steve, it's not a silver bullet answer to this question, but I would say we're not making progress because we're not listening. We need to listen to our mothers and what they need and require while they're in the stage of birthing. You know, when I was having my son, I was very excited and very nervous, but I didn't have all the information I needed. And I trusted my doctor who could help me navigate the system. And there were times where I even was having challenges, but my doctor could advocate for me. Every mom doesn't have that as a resource. So trusting folks like doulas and people to come in with them and be a part of the birthing process is important. But we can't just think about what happens in the medical system. It's also the community context. It's when you bring that baby home and being able to have a home visit by a trusted practitioner who is culturally competent and understands the needs of you and your family. It's about having access to fresh foods and nutritious foods if you can't afford them through programs like supports through the WIC and SNAP program where babies and moms can have the nutritious foods possible. It's about transportation, Steve, being able to get to those first critical doctor's appointments. So it's a series of wraparound services that we need to make sure that moms and new families have when they bring their babies home.
Complex stuff, and people who think there are simple answers just may not understand how challenging it is. Maisha, I want to thank you so much for joining us, and also thank you and your colleagues at the Robert Wood Johnson Foundation for the work you're doing. Thank you, Maisha.
Thank you, Steve. It's been a pleasure to be with you today.
Right back at you. Steve Adubato will be right back.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by RWJ Barnabas Health, the Healthcare Foundation of New Jersey, Berkeley College, Bank of America, the Northward Center, MD Advantage Insurance Company, Fedway Associates, Inc., the Adler Aphasia Center, and by the Fidelco Group. Promotional support provided by Insider NJ and by AM 970 The Answer.
Hi, I'm Abby. You might see me as an ordinary person, but I've been living with a brain injury since 2018. Opportunity Project gave me hope, and I've gained confidence through job skill training and helping my family. Despite my challenges with memory, I see a possibility to keep improving.
If you have a brain injury, you don't have to face your road to recovery alone. Learn more about Opportunity Project and its partnership with Children's Specialized Hospital.